It's Monday, the 21st of November 2016. I'm Russ McLean, Chair of the Patient Voices Group, and today I'm in conversation with the Chief Executive of East Lancashire Hospitals Trust, a trust which serves the population of Pennine, Lancashire and beyond. Mr. Kevin McGee, hello.
Good afternoon, Russ.
Good afternoon. I'd like to start today with questions around the STP, which is the Sustainable Transformation Plan. So first of all, what is the STP and how will the Trust play a part in the delivery of the plan?
So there's 44 of these STPs across the country, and they're really trying to put in place some longer term strategic planning. So the STP that we're part of is called Lancashire and South Cumbria. It covers that patch, and it's trying to bring all hospitals and all of the commissioners or CCGs together with local government to think about how we can plan services in a different way. Because as we all know, there's financial pressures within the NHS, but there's also workforce pressures. So it's really about how we can plan services on a larger footprint, and we are supporting that work very strongly. It's led by CCGs and commissioners at this point, which is right, but we as a major provider are supporting that work and are really heavily influencing it, because clearly as the Chief Executive of East Lancs Hospitals Trust, I want to not only maintain but develop the best services for the population of East Lancashire, and so I have to be in there working with colleagues to make sure the right decisions are taken for our population.
In the past, I suppose it would be fair to say that the Trust hasn't always been good at engaging the community it serves. So how does the Trust plan to engage with patients where services may be affected by this redesign or reconfiguration? I mean, shouldn't you include patients with your discussions around efficiency savings, which is basically what we're talking about?
So whatever happens in terms of any longer term plans through the STPs, absolutely stakeholders, patient, community engagement has to be at the centre of this. I think at this stage there isn't actually anything really to engage about, because there's not been any plans actually developed and the work is starting to kick off now. As I said, it is being led by the CCGs, and there needs to be, and I know there will be, a very active and strong engagement campaign with our communities and members of the public. So I would absolutely support that, and I think it's vital. I'd go one step beyond and say it's absolutely vital that all of stakeholders in East Lancashire, Pennine Lancashire, get together, get behind the STPs, but also make sure we get what's right for our population, because there are going to be some big decisions that are going to have to be taken going forward across Lancashire and South Cumbria. And it's really important that the people of Pennine Lancashire understand those decisions, and more than understand those decisions, can absolutely influence those decisions. So I am absolutely with and behind public and patient involvement in this STP process.
Sustainability and Transformation Plans STPs, which involve cuts to services, maybe any department closures or hospital mergers up and down the country, maybe not in East Lancashire. They've, as you said, yet to emerge for 44 areas across England. But the King's Fund is suggesting that this is because NHS England has instructed local hospital managers to keep the plans out of the public domain. What would you say to that?
So I don't know what's been said there. We are certainly not trying to keep any plans out of the public domain. There isn't any plans yet in terms of what services could look like for the future, because we've not done that work yet. And I repeat what I say, it's really important that we have a very open and honest conversation with the public in terms of what NHS services will look like in the future. But I also think it's right to say that we do need to think that there will be some changes. I'm hoping those changes are really positive for East Lancashire, but there will have to be some changes. You know, we have financial pressures and we can't ignore that. But also we've got workforce pressures. So if you think of over the next 10 to 15 years, there isn't the doctors and nurses in the pipeline that are going to be required to keep all of the services they currently are across Pennine Lancashire and across the whole of Lancashire. So we are going to have to think about how we can do things differently. You know, what you've got to think about is healthcare never stays static. If you think about what the healthcare environment looks like now compared to what it was like, say, 15, 20, 25 years ago, it's radically different. take Blackburn alone, the hospital configuration is completely changed. So things are always evolving in terms of how and where healthcare services are delivered. And that's right. What we've got to make sure is whatever happens in Pennine Lancs is the best possible outcome for the population and the people that we serve.
There are those perhaps saying that this is more about finances and balancing the books than it is about patient care. Let's bring it back local. I'll put you on the spot, as it were. What does that mean for you, for East Lancs Hospital Trust? Are you worried personally that these cuts or these reconfigurations are going to affect the services that you're able to provide?
I mean, the honest answer is I don't know at this point. I would hope that we can win the debates and arguments that not only keep our current services but also extend our services across East Lancashire, because I think we're in a really strong place to provide more services to the whole of Lancashire. What I can't guarantee is the current, if you like, configuration of services will remain as it is, because as I said, health services are always changing as you go forward. So we have to recognise that we've only got limited budgets. We have to recognise that there are workforce constraints, and therefore health and how health is delivered will change for the future. And all I can absolutely promise is that we keep everybody informed and have a proper and open and honest dialogue between everybody in terms of what those services could look like, and let everybody have their views and opinions heard.
Nursing associate roles will be introduced into the NHS in England from January 2017, and I'm told that nursing associates will receive 2 years of training and that their main duty will be to support the work of fully trained and qualified nurses. The qualified nurses should be supervising everything that the associates do to help train them and ensure proper patient care. However, a local newspaper has recently exposed the intention to allow these underqualified nursing associates to measure out doses of medicine and carry out invasive procedures without supervision. That wasn't what was promised. So my question to you, Kevin, is will the Trust be employing these nursing associates, and what assurances can you give your patients that they will be safe and that these nursing associates will be absolutely supervised?
So we've done a lot of work over the last couple of years to increase the numbers of qualified staff on our wards. So if you go across all our wards now, we try and, on balance, try and have a ratio of 1 of 8 patients to every qualified nurse, and we would not compromise on the level of qualified staff that we have. It's right to say, looking for the future, we are looking to employ different forms of nurse associates going forward, whatever you want to call the new group of staff that's being considered, but they would always be appropriately supervised, and we would never ever compromise on patient quality because of the staff and qualified staff ratios. So I can give an absolute guarantee that we will always have the appropriate ratios of qualified to unqualified staff on our wards.
Are these new group of staff, are they a step up from healthcare assistants?
I think they are a step up in the level of training that they will receive, and will be more enhanced than the current nurse associates. But again, the workforce is always evolving. Patients' needs are evolving, so we need to keep pace with that. And I think it's right that we should consider what these nurse associates would look like and how they can support the qualified staff on the wards. But as I say, we would never compromise on the quality of the staff that we have, and in terms of the qualified to unqualified ratios.
And I think it would be perhaps prudent to remind patients that even healthcare assistants now have to meet a certain level of qualification.
They do, and I think we should be proud of all of our nursing staff, all of our staff per se, but I think particularly our nursing staff across East Lancashire Hospitals Trust. They do fantastic jobs day in, day out, whether they're qualified, and you go from consultant nurses through to healthcare assistants, and whatever they do, they receive the appropriate level of training, they have the appropriate level of supervision, and there's the appropriate numbers in all of our wards and departments.
I'd like to turn my attention now to a letter I've received this week from the family of a patient who unfortunately passed away. They remark that the care their mother received on Ward C2 was generally good, so please do pass that on to staff. But they have concerns which I feel might or may affect a number of terminally ill patients, and those concerns affect the privacy and dignity of patients at the end of their life. Their mother was in a bay in which there were several ladies, one who clearly had mental health issues, and she was screaming and shouting quite loudly. Their mother and other patients and some visitors were quite distressed by the noise this lady was making. But there were other noises too. Staff, patients and visitors talking, laughing and joking, and of course the general noise that we've come to expect of a busy hospital. So I wondered if you could explain the Trust procedure when it comes to terminally ill patients who are at the end of their lives. Why aren't these patients allowed the dignity of dying in peace and quiet, perhaps in a side ward where they can end their last hours in privacy and dignity? You know, surely this is a basic need, really, and part of the NHS constitution.
So I'm really sorry to hear about this story. Of course, the very least anybody can expect at the end of their life, and their families and friends can expect, is that people die with privacy and dignity. Where it is possible, you know, we would always try and put somebody on a side ward if that was possible, but we are limited. We only have a small number of side wards, and if those wards were in use for other issues around infection control, etc., we certainly couldn't guarantee that that patients would be able to have those wards at the end of their life. But you're absolutely right. The very least people should be able to expect is dignity and respect, and I'm really sorry if that's not the case and it didn't happen in this instance. I mean, what I would also say is that we need to think as a society about whether, you know, a busy acute hospital is the right place for people at the end of their life. I think more and more there are alternatives, so we can provide support for people to die in their own homes. We can provide support for people to die in nursing homes and in hospices, etc.
Let me just jump in there, because I think maybe 20 years ago it was the norm for people to have to come into hospital to end their days. That's what you're saying now, is it? That's not the case.
It's not the case, and I think there are lots of alternatives that people can think about. You know, when it's getting near to you know, sort of at the end of their lives or their relatives' lives, that there are alternatives. And you know, a really busy acute ward, actually, it's probably not a great place to be for the reasons that you've explained. Now, clearly, you know, there will be deaths in our wards. Sometimes it's unavoidable, and sometimes it's where people do want to die, and we will always try and provide the best possible environment that we can. But there are alternatives. And I can only think, you know, I'm talking personally now, if it was one of my relatives, actually I wouldn't want them to die in an acute setting. I'd want them to be somewhere else where it's perhaps more homely, or they can have more of their family and their things around them.
Is it right to say that there are things in place now for people, and it's a better service that people can expect if they want to pass away and end their days at home? Are those services in place?
Well, yes, absolutely. I mean, we've done a lot of work around our end-of-life services, both in the hospital but also out of the hospital, to support people to die in their own environment. So I know these are difficult conversations, but there's certainly things that people need to think about and explore when the time is right, with our staff and with members of our teams.
It's great news that staff at the Trust have been heavily featured by local and national media recently. Let's talk first of all about Alistair Gray, pharmacist, and his innovative work and the Refer to Pharmacy scheme. Can you tell me what that is?
So this is a really great piece of work that Alistair and the team have been undertaking. And in its simplest form, it's really saying before people are discharged, we can send information to local pharmacists so that local pharmacists have that information before and when people are discharged, so that they then can collect their medicines from their local pharmacist. And it's about how we share information between ourselves and pharmacists. So it's a very innovative scheme. It's based on some really good new technology, and actually we're the first trust in the country to really taking this on board because of the work that Alistair and the team have done.
Well, congratulations for that. However, the government plans to close over 3,000 pharmacies across England. So isn't this giving out sort of mixed messages when we're telling people not to come to A&E but to go to their GP, or even think about going to see a pharmacist?
So it's difficult for me to comment directly on that, because I don't know in terms of, you know, the figures and the numbers of pharmacists that the government are thinking of. But the theory behind it is we've got an oversupply, and therefore we can, if you like, manage the market better and regulate the market without there being any impact on services. Whether that's the case or not, I couldn't really comment.
A recent Health Watch report has highlighted that 52% of patients are put off by complaints procedures. This was a piece of work that was done across Lancashire. Now, although undoubtedly you here at East Lancs Hospital Trust are receiving less complaints than you were 5 years ago, it seems that patients are still unhappy with your complaints procedures, with some 55% of those who responded saying that they felt unsupported or didn't receive an adequate response. So please, Kevin, could you tell me about your complaints process and what patients can expect if they have need to complain?
The first thing I'd say is it's important to realise that the figures that you're quoting are Lancashire-wide and they don't relate to East Lancs Hospitals Trust. And as you quite rightly say, we've done an awful lot of work recently in our complaints process, and our overall number of complaints is actually down. However, that's not to say complaints are particularly a bad thing, because we learn an awful lot from complaint, and if we get things wrong, we need to know about it. So I would always encourage people, if they wish to make complaints. What we've tried to do is to head things off if you like, before an official complaint is made. So we have what we call our PAL service, but we also have our ward staff and our matrons who are empowered really to talk to families and to talk to patients if they've got any concerns, and really deal with their concerns there and then, and try and stop them from escalating to a formal complaint. Because what we find is that most of the issues that people raise can be dealt with immediately and are better dealt with face to face. So that's the first thing. However, if people do wish to make a formal complaint, there is a formal complaints process that people can go through. They can write, and then we will clearly instigate the complaints process. We will investigate thoroughly. We will respond both written and orally, and if people wish, we can bring people in to talk to the clinical teams and to talk to the managerial teams about the concerns that they've had. So there's a very detailed process that we go through, and we take the complaints really seriously. If people are not happy, then there's always other ways they can go. So they can complain to the Health Service Ombudsman in terms of making complaints, and there's always that independent route that people can go through. So complaints are really important for us. Clearly, I would wish that we had no complaints, because all our services were that good. But I think the nature of healthcare and the fact that it's always about an element of risk, there will always be some complaints, and it's important that we hear those complaints.
I think, and I've had personal experience of this, people and patients have come to me and said that they're a little bit worried about complaining or saying things upsetting the apple cart for their relative, because that relative might get treated more differently. What would you say to give reassurance to those patients?
I would say absolutely not. Myself and all of the staff in East Lancs Hospitals Trust would not be doing their job if we ever allow that to happen. So if I had any inclination or found any instances where that was happening, I would stop that from happening immediately, because that is wholly and totally inappropriate.
The winter season is upon us. Let's talk A&E. And the 4-hour target. So this is a target set by government that all patients who present at A&E can expect to be seen in 4 hours. You've missed that target every month for a year, up until I think it was October or thereabouts. Admittedly, the trust here isn't an outlier, with most trusts failing to meet this target. What are you doing to improve that performance?
So just a slight technical correction first. It's not all patients. It's 95% of patients should be seen within the 4 hours, because it's always accepted that there'll be about 5% of clinical expectations where people, because of their clinical conditions, can't be seen. It'd be wrong for them to be seen within the 4 hours. But your substantive point is absolutely right. We're not hitting the 4-hour target, and along with most trusts in the country, we've failed it. We are under a lot of pressure in terms of A&E. The A&E department at Blackburn is the busiest in the northwest in terms of blue light conveyances, by a long margin. We are incredibly busy. Through our A&E and our urgent care centres, we can see in excess of 500 patients a day, every day, and the staff that work there are under an awful lot of pressure. What we try to do, we try to put more doctors and more nurses in to support, although having said that, there ain't the doctors and nurses on a national basis to do that. We've also tried to look at how we discharge patients so that we can improve flow, because quite often the reason patients wait longer in A&E is not because they've not been seen initially by a doctor in A&E, it's because once they've been assessed, if they then need to have a bed, we've got delays in terms of access to beds because we can't discharge as quickly as we should do because of other issues. So a lot of technical work's going on in terms of the whole system about how patients come in, how quickly they are assessed and triaged, how quickly they're then treated, and how quickly then if they're moved to a bed, that happens. So, this is probably our number one piece of work in the trust that we're engaged in to get this right. And a massive amount of money, time and effort from all of our staff has gone in to try and get this right.
Would you not agree with me that a lot of this, I hate using the term bed blocker, it's not the right term, but particularly those elderly patients who are waiting to perhaps be discharged into a care home or to onward care and can't be because basically the collapse of the social care system. So my point is, if we had a better social care system, wouldn't that have a knock-on effect and give you that capability?
So the social care system is under enormous pressure, and I've got real sympathy for colleagues who work in social care because they are under immense pressure. I have to say across Pennine and Lancashire we work really well with colleagues both from Blackburn with Darwen Council and also from Lancs County Council, and we do the best that we can within the resources that we've got, and the working relationships are really good and the colleagues really try and help and support us. But it's fair to say that on any particular day I can have between 80 to 90 patients who are medically fit for discharge. That's 4 wards or so of patients who are medically fit for discharge, but for various reasons we can't discharge. Not all related to social care, but some of them related to social care. So it is a real issue for us that we need to deal with as a system. We are working very hard, but it's a big problem for us.
The listeners don't have the advantage of being able to see your face as you're answering these questions, and I can see that when I'm talking about the 4-hour target, you do get really upset about it.
I do, because it's something I'm living and breathing every day, and it's not a good patient experience or environment for people to be stuck in A&E for hour upon end. It really upsets me when I go down there and you see patients who've been in the A&E department for longer than necessary. So it is a real concern to us, and it is. I can absolutely say to your listeners, Russ, that this is our number one issue that we're trying to crack. But there's so many issues that impact on it. So, the number of patients who come in and want an urgent care and ED, the capacity in primary care to manage patients out of ED. As you said, the support that we've got then in terms of social care to discharge patients, the number of beds and the capacity I've got in my hospital because of the doctors and nurses and how many beds I can physically open. It's a really complex piece of work. There is no one issue that will resolve it. There's hundreds and hundreds of interactions that come together to try and improve this, and we are working on every individual one of them.
And of course, you're the chief exec, the buck stops with you. So how worried are you going forward? Because we've only just started the sort of winter season, the winter pressures with all the coughs, the cold, the flu, the trips, the slips, the falls. How worried are you?
So, yes, I am worried. At one level, I'm really confident and reassured because of the work that we're doing as a system. And as I said, we've got great support from partners. The one thing about Pennine Lancs is that we're all in this together. So be that the hospital trust, be that the ambulance trust, be that social services, be that our commissioners, everybody recognises that we've got to work together in this. So that gives me a degree of confidence that we can manage this. But clearly, if we get a really bad winter and we get a flu epidemic, or we get incredibly bad and difficult weather, it will put pressure on the services, and we are already busy. So, I know I keep saying this, but I'm going to take the opportunity again to your listeners. Please think very carefully about whether you actually need A&E or urgent care. If you can nurse yourself, then do so. Use 111. Use pharmacy services. Go to your GPs. Really only use urgent care or ED if it's absolutely necessary.
As the largest employer or one of them in East Lancashire, how seriously do you take the mental health and well-being of your staff, given the fact that, of course, the caring environment is a pretty stressful one?
It is a really stressful environment. When I go around our wards, if I go around the ED or urgent care department, I am always humbled by the professionalism of our staff and how hard our staff are working and the pressure that the staff are under. And it is something I do have concerns about, and I am worried about the health and well-being of the staff. We do everything within our power to support those staff. So, we have very family-friendly policies that we employ. We have physiotherapy support where because there's lots of issues and pains with people's backs, etc. Physiotherapy support that staff can access. We have counselling support that staff can access. So we take the health and well-being of our staff as really important, because if you have a fit, healthy, motivated staff, they will provide better care to our patients, which is ultimately what it was about. So I do take very, very seriously the health and well-being of staff. And I have to say, there are times when I am concerned about it because of the level of pressure that staff are under. And what I would say to your listeners, and if you can get this message out, particularly in places like ED, but also the wards, when you see that staff are under such pressure, please just cut them a little bit of slack, because, they mightn't get to you as quickly as they should do, or they mightn't be able to answer all your questions, but it's not because they are want of trying, it is simply because of the enormous stress that they're under.
This is a sweeping generalisation that perhaps might sound strange coming from the chairman of the Patient Voices Group, but do you think patient expectations has far exceeded what it was 5-10 years ago, and that perhaps patients expect a little bit too much?
I'm not sure patients expect too much, but certainly patient expectations have grown. If I go around and speak to staff on the ward, patient expectations is now significantly different to what it was 5 years ago, and a lot of that relates to communication and information, and that's right, and that's something that we should be providing, but that's sometimes difficult when staff are under the most enormous pressure. So I don't think people's expectations are too much, but people's expectations have certainly grown over the last few years.
Well, of course, I'd like to share with all our listeners about some of the great news recently about the Trust restaurants in Burnley and Blackburn. Kevin, tell me more.
So there's an awful lot of work going on in terms of sort of the quality of the food and the environment in which we serve the food. Both our two main restaurants in Burnley and Blackburn have been rated with the highest food hygiene standards of 5, which is great and real testimony to the work that's gone on in the organisation.
I have to say that Burnley General Hospital's catering team cater for up to 250 inpatients as well as visitors, surgeons and staff, and the Royal Blackburn Hospital caters for over 880 inpatients every day. That's some food service.
It's phenomenal, really, when you think about it. And actually, Russ, thank you for the work that you're doing in terms of supporting the hospital and supporting the department in terms of trying to understand how we can improve services. I mean, we've done so much work recently in terms of trying to improve the nutritional value of food that goes to our wards and it's served to staff and patients in our restaurants. We've gone for really healthy menus, but really nutritious and very exciting menus. So the food, I think, is as good as anything that I've tasted in any hospital anywhere in this country, and I think we should be really proud of the catering department and the work that they do.
And having sat on the panel that tested and tasted all the food, I can really recommend it.
It is. I mean, it really is good. If you think about some of the jokes, the historic jokes about hospital food, what we actually now serve in on the wards and what we can serve in the restaurants is of a highest standard possible.
And I think we should not forget that, eating and eating nutritious food is all a big part of getting better.
It is. One of the things I think, and that one of the big changes in terms of health provision is something that we're really understanding now, is it's about the whole package. So it's not just about the direct clinical care, it's about the ward environment and whether that's nice and bright and welcoming. It's whether the staff are engaging, it's whether the food is of the highest quality, and all of that helps to improve people's health and well-being.
And I think through PLACE, which is the patient-led assessment of the care environments, you and the Trust have worked very hard to ensure that those sorts of environments exist here, certainly at Blackburn and Burnley and the outlying hospitals in the community.
No, that's absolutely right, and it's something we take very, very seriously because, as I said, we recognise that the direct clinical care is only part of what it means to get people healthy and well and give them a good experience.
Kevin, I'm at the end of my chat, but I recognise, I think, that everyone who works in the health economy is worried this winter. Are you one of those people?
So I think it's fair to say that the NHS is under a lot of strain and a lot of pressure. I still think it's the best health care system in the world, bar none, and it's something I'm immensely proud of. I'm also immensely proud of what we do in East Lancs Hospitals Trust, and I think I am confident that we will be in a good place going into the winter, but we can never be complacent. As I said, if we have a really difficult winter, we have a flu outbreak, we have really bad weather, we will be under significant strain. So I think we're all in this together. The hospital, its staff, the communities that we serve, we all want the same thing, which is about a really strong, vibrant hospital and community services. So let's work together. If we don't get everything right, please bear with us, but please tell us, and let's celebrate what we do well